All right. And thank you so much, everyone, for being here for Women Who Led Us Through the Pandemic. This is a roundtable discussion. We have some wonderful speakers. Before I get started with introducing everyone, I just want to turn it over to Supervisor Catherine and Stefani. Thank you so much for having me.
Thank you so much, Meaghan. We do this again together, so thank you. I'm so glad you're here. And good afternoon, everyone, and thank you all for joining us today. And welcome to the Women Who Led Us Through the Pandemic Roundtable. Over the past year and a half, we have faced unprecedented challenges. Our communities, healthcare and education systems, childcare, housing, and small businesses all faced extreme obstacles related to the pandemic. And it really was the women of San Francisco that were in positions of power to take the lead. I remember sitting at a hearing on the state of our vaccinations, and as I looked around the virtual room, I saw that it was women who were running our COVID response. And I believe one of the reasons for this was that the pandemic really disproportionately impacted women in areas like childcare, education, and job loss. Compared to men, women lost more than 1 million jobs in the United States, and that does not include the number of women that were forced to quit their jobs to support their children in remote learning. And it comes as no surprise then that women took the lead during this crisis, and women must now, of course, be at the forefront of recovery. Today, in San Francisco, 76% of all our residents have received the vaccine, a true testament to the successful coordination of city services. And while we know we are not out of the woods yet, particularly with the rise of the Delta variant, I am eager to hear from this strong group of women in public service as they reflect on their roles, successes, and insights on meeting the crisis head on. So now I'll pass it back over to Meaghan Mitchell of Hearsay Media, who will serve as our moderator today. And thank you again, Meaghan, for being with us today.
Thank you, Supervisor Stefani. And greetings, everyone. My name is Meaghan Mitchell. I'm your moderator for today's panel discussion. Just a quick little about me. First and foremost, native San Franciscan, and I'm also a journalist representing Hearsay Media. And we're ran by a fellow team of San Francisco reporters who believe in the power of the city. And we work daily to provide the information you need to hold yourself, your neighbors, and your city accountable through our reporting. And you can follow us at hearsaymedia.org. Now, before I introduce today's panelists, I want to start by setting the intention for this space. These discussion norms were put together by the Office of Racial Equity, which was recently ran by Shakira Simley, and she's just another amazing woman who supported us throughout this pandemic. I'm going to go ahead and share my screen, and I just invite you to take a quick look before we get started. Thank you. And hopefully everyone can see that. All righty, and I'm back. Now, before I get started, just some quick housekeeping notes. Just so everyone knows, this panel discussion is being recorded and it will be available later. If you have questions, feel free to drop them in the chat and we'll get to them as soon as we can. Now, at this time, I'd like to introduce our panelists. Joining us here today is Director Mary Ellen Carroll, who is the Executive Director of the Department of Emergency Management. We have Dr. Naveena, Bobba, who's the Deputy Director of Health for the San Francisco Department of Public Health. We have Dr. Andrea, who is the COVID Task Force Lead. And then we have Abigail Stewart-Kahn, who is a Special Advisor for Children Family Recovery Department of Children, Youth, and Their Families, and also the former Director of the Department of Homelessness and Supportive Housing. We also have Maria Sue, who is the Executive Director of the Department of Children, Youth, and Their Families. And last, but definitely not least, Supervisor Catherine Stefani. Thank you all so much for joining us today. All right, so this first question I'm gonna ask is just an around the room, and I'll start with you, Ms. Tenner, because you were the first person I see on my screen, and then we'll just go around the room. The question is, why is it that you think so many women, including Mayor Breed and Dr. Phillip, who unfortunately couldn't make it, were the leaders throughout this pandemic?
Thank you very much. And it's really a pleasure to be here. So thank you to Supervisor Stefani for organizing and to all of my fellow panel members who we've spent a lot of time together over the last year and a half. So, you know, I think that there's a couple of different reasons. So one of those things that I think might be leading to some of this is I think the openness of San Francisco and the leadership here, and the ability to have people who to have women in leadership positions. So I think we started with women that were in leadership positions, and this is a space where women were encouraged and allowed to reach their full potential. So I think that really helps. I think we have incredible male leadership, we have incredible female leadership, but I think it's a space where people were allowed to kind of reach their full potential and come together. I think also, you know, I think there is, I think in San Francisco, we have a tendency, or we have a collective spirit that I think is unique to this city, and I have really come to appreciate. I am not a native San Franciscan, but as the saying goes, I got here as fast as I could. So I really appreciated that element, and I think, you know, as women, I think we tend to see the need and tend to want to help and to be a part of the solution. And I think that there's a space here for us to be able to do that and to use our expertise. And I think leadership set a table that was open for people who to come and bring their experience and together to make this better. Thanks.
Thank you so much for that, Mary Ellen. Carroll?
Thank you, and thank you, Meaghan, and thank you, Supervisor Stefani, for bringing us together. I just have such admiration for everyone in this room. I'll just be brief. I think part of it is that this was by the way, while we are looking back, we are still fighting forward, and we're by no means out of this. So, and that speaks to the duration of this and the endurance that one needs. This was not like, you know, this isn't like heroic stuff like an earthquake, like running into a fire to save lives. This is slow, arduous, painful, and enduring work. And, you know, women in general are tenacious and badass, and I think, you know, tend to stick with it. And I also just want to say, like, there was a bit of an opt-in component to this work. There's a core group of people that are here who are disaster service workers who you know, were able and made the choice to step forward and serve during this time. And a lot of them were women. There's men also, non-binary, you know, we've got the whole crew, but it is true that a lot of leadership was women. And I just see it as a part of our own tenacity and a kind of a stick with itness and patience to muddle through this disaster, which is not an exciting thing. It's painful and hard and requires a lot of discipline. So all characteristics that I think women have to have in this world, to work in government, to work in the fields that we work in, and to be leaders. So thank you.
Thank you. Abigail?
Echoing others, thanks for having us, Supervisor, and Meaghan for hosting us. Hello, fellow women. You are all amazing, and you also look beautiful, which is remarkable after 18 months of incredibly hard work. So I'll just build on that, which is that, you know, I think San Francisco has done everything right in impossible times, and we have not done everything right. We have made mistakes, and part of what doing everything right has meant is seeing those mistakes, admitting them, listening to community, and continuing to build. I think thanks in large part to women leaders have specialized traits that really prepared people for this moment. Of course, people of all genders have these traits, but I particularly saw women These women and many other women demonstrating collaboration, communication, calm in a crisis, bringing out the best in people around us, and our commitment to our individual missions and our shared mission of public service. And I think that the pandemic has just been a real opportunity for women to shine who bring those traits forward.
Thank you. And Dr. Naveena?
Yeah, I also want to express my gratitude for being able to share some of this work that everybody has done over the last year. And I think one of the things that I think about is actually in healthcare, there is a large representation of women and in the Department of Public Health, and you know, from nurses to doctors to MEAs, we do see kind of, and I don't know if it's just because that's, you know, the profession that women choose to go into, but it really speaks to the fact that most of these women were called upon during this time to be the frontline healthcare workers in the pandemic, and the incredible sacrifices that had to be made both by men and women, but specifically, you know, and we have to remember early on in the pandemic, we didn't know much about COVID. So putting kind of their lives at risk to help others who were extremely sick. I think about those stories every day and the toll it took on themselves and their families, especially mothers who, you know, had to come home and potentially had to socially distance and didn't feel comfortable sleeping or interacting with their families because they didn't know what that interaction might lead to. So I think there's just this toll that has been unspoken. I mean, there's a lot of data out there about how the pandemic disproportionately impacted women, but it's just something that we have to continually remember how much women did sacrifice during this pandemic to really ensure that people got the care that they needed and that they could then, you know, recover and be with their own families as well.
Wonderful. Maria?
Thank you. And I also want to echo my thanks to Supervisor Stefani and Meaghan for facilitating us. And then, of course, being a part of this fantastic panel of amazing women. So I echo and agree with everything that everyone has said. You had mentioned Mayor Breed and Dr. Phillips, and I just personally feel like both of these women, not only are they badasses, but they literally took leadership and the definition of leadership and redefined it for themselves. They made it bold, they made it passionate, they made it emotional, and they made that all okay. And because they said that you can lead with passion, with boldness, with a lot of emotion and care, it made it easier for me to step into my leadership and be able to then draw on my own intuition and my years of experience in my field and leaning on my team. And I think that's the real definition of leadership. Being able to ask the questions and then listen to the answers and then take all of that information and act quickly and decisively. And I think those are the things that women, particularly in San Francisco, in positions of power, did, and we did it really well, as demonstrated by the way we responded during this pandemic.
Thank you. Well said. And Supervisor Stefani?
Thank you. Yes, I love this panel because I love all these answers so much. And, you know, the fact that we have such incredible women in place to begin with. I'm leading with our mayor, who has just been absolutely fantastic during this crisis, and Dr. Phillip as well, who couldn't be here. I mean, when we invest in women, this is what we get, right? We get strong leaders who we empower to make difficult decisions. You know, this was very emotional. We saw what our school kids were suffering through, and we created community hubs. You know, we saw what our seniors were going through. We made sure they had access to groceries and medications through, like, we did a phone bank here and led volunteers to help others. So I think, you know, when you invest in women, you make sure they're in positions of power to begin with. You know, the results in this case, you know, we've shown what women leaders can actually do through this pandemic. So I thank you all for your leadership and for the positive outcomes that we have had and that we will continue to have as we carry on through, like as Mary Ellen said, we're not out of this yet, so.
Thank you. And this next question actually is for Mary Ellen. I'm just wondering, how had the city planned for such an event, and how do you feel we met the moment?
Well, interestingly, when I started working for the city 17 years ago at the Department of Public Health, one of the projects I worked on was a pandemic plan. So obviously it's been something that's, been in the portfolio for a while. But in general, this city prepares for we have a kind of a multi-hazard perspective that we prepare for everything that we can think of and things that we can't. We've worked very closely with the health department and FEPR, for which Dr. Tenner is now the director, for which we're very grateful. I think following Naveena's footsteps at some point along the way, I can't remember all the, but that relationship with health was important, and with all of our partners. But did we, how did we do, or without question, I am incredibly proud about how we met the moment. And a lot of that has to do with the women that you see here and hundreds of other people behind them. The numbers tell the story. We know without a doubt that countless lives were saved by the work that we all did. And starting with the mayor making those really tough decisions that she has to continue to do today, as she leads us forward, and taking into account all the needs of the city while in a pandemic. But then, everyone else coming forward and not giving up. And it's not just those of us who are in leadership positions, it's the people that work under us within the health department, all of the healthcare workers, everyone that works, who runs a hospital and makes that work, under HSH, the folks that do just incredible life-saving work every day. I mean, we can, the librarians, the accountants, the rec workers that, when the school district wasn't open, Maria and her team, heroically provided opportunity for the kids that most needed it, and for kids of the essential workers, so that we could go do our job. And one of the things that we know, and I don't know if we'll get into it, but like the impact on women across this country and the world from this pandemic has been really detrimental, right? Because women have had to step back and they've had to take care of their kids and, play that role to keep families going, et cetera. And for which we're grateful. But we've got to change things if we're going to continue to see this kind of leadership among females. But 100%, I could not be more grateful, more honored to work along the employees and the disaster service workers of San Francisco, and honestly so privileged to be able to play a leadership role.
Thank you so much for that. My next question is for Supervisor Stefani. Wondering, were there any sustainable outcomes that emerged from responses to the pandemic that will change city policies? We saw the city become more flexible than ever, and of the varied responses, will any of them last?
Yes, thank you for that question. I think it's so important because we had these emergency powers, right? So we were able to respond as things were coming up, and we learned a lot as well. And the sustainable outcomes, I think, just starting with small businesses, we really saw how fragile our small businesses were. And, everyone hears complaints about how hard it is to operate a business in the city, but then you throw a pandemic on top of that. And we saw our restaurants and retailers lose 90% of their revenue, and over half of our small businesses closed. So we know that's going to take years to recover from, but one of the sustainable outcomes is the fact that we have now shared spaces, which just passed. The mayor signed the other day the legislation. And I think it's a great response to allow our restaurants to come back to life, give them some stable planning in terms of they know now they can rely on these shared spaces for revenue planning, paying loans back and everything that they've had to do. Open spaces, we saw that people were really itching to be able to get outside close to their home. And I think that we've learned a lot about how we create open spaces in our small little city here. And I think that a lot of that will be sustainable. We know that JFK Drive is up nearly 600% thanks to the closure, and the foot traffic there has also increased. So I think we'll see some sustainable outcomes out of that as well. Education-wise, I think too that we really saw how fragile our public school system was and how much we really need to invest in it. And like, I do agree with what the heroic efforts of Maria Sue and others to respond with the community hubs. I mean, we really have to focus on how we get our children back and recoup that learning loss that they suffered. So I think the sustainable outcome there is really making sure we are doubling down on what we are doing in our public schools and making sure we have the resources to not only educate them, but feed them. The mandated reporter thing what really affected children, and child abuse went up, but the reporting went down because nobody was there to see it and report on it. So we know that's something we have to deal with. And lastly, I want to say something about domestic violence, because a sustainable outcome there for me, because I've always known domestic violence is a crisis, and it takes a lot of effort to really get at it. There's a cycle of violence, a cycle of abuse. There's a lot of things at play there. It's sometimes hard to prosecute because you have unwilling victims. But what I saw when the calls to domestic violence services went up, and we know that the shelter, it was not there for families who are suffering under domestic violence. 79 of the clients were turned away in 2020. So for me, really concentrating on that effort and going forward to understand what domestic violence is doing to our communities, to our children. I know through data that domestic violence is not being prosecuted in the way that I believe that it should. And a sustainable outcome there is the fact that I have legislation pending that will require reporting so that we have a clear picture of what is happening. Because when our children are suffering at home, when they're watching this domestic violence, it just ripples through everything. And we have to do everything we can to help families that are suffering from domestic violence, including the abusers themselves. So for me, those are some sustainable outcomes that I'm really focused on, and I'm proud that the city really rose to the occasion for a lot of those.
Thank you so much for bringing all those points up. Given that you just talked about domestic violence, homelessness, just being a mom at home and trying to work with kids, all these different things even we go through as women, I'm just curious for all of you, and I just would love to go around the room and ask, what is it like for you being a woman in this position and having gone through this pandemic with all these different things that are happening? We'll start with you, Maria.
I am very fortunate to have an amazing partner who was able to help carry the load for me when I had to have those early morning meetings with Mary Ellen and the late night meetings with Mary Ellen as well. So having a strong family structure for me was extremely helpful. I've never really truly believed in the work-life balance. I really believe when you're at work, you are 100% at work. You are there. And when you're home, you're 100% there. For me, I just feel like my children deserves more than 50% of my attention. And then also I'm a mom of 2 kids. And so I have to figure out a way to meet all of these demands. And I think when I was talking earlier about relying on your intuition and relying on your experiences, it's intuition as a mom, intuition as a woman, intuition as a leader. And so for me, those are the things that really strengthened during this pandemic. For me, I trusted my gut more during this process. So, when both Supervisor Stefani and Mary Ellen talked about the learning hubs, it's one of those things where I saw certain data points and I just couldn't turn away from them. And it hurt me. It hurt me to my soul. As a mom, it hurt. But then as a policy leader, it hurt. And so these are the things that gave me the energy to make change. And then, of course, leaning on my colleagues to help me move that change and move the idea forward has been just a blessing.
So with like work and school drastically changing due to this pandemic, what were some of the challenges? And just 1 second, I just want to stick with you for a second, Maria, that you ran into as students shifted to online learning? And how do you think the youth of San Francisco will be changed from the pandemic?
Well, we know that this pandemic spared no one, right? It wreaked havoc on our community, on our families, on our children. And as I referenced earlier, when I saw some data points that our school district partners were sharing around children that was connected to the distance learning platform and how long they stayed on the distance learning platform, it really, truly hurt my heart, because you saw what we have known in our city for a long time, but you saw in data points of just children, our most marginalized children, not actually being connected longer than 30, 40 minutes at a time. And you as a mom, you're like, how in the world are you going to learn anything if that's the case? So those are some of the things that when I saw those data points, I said, we have to do something. And then, of course, when I shared that with Mayor Breed, she was like, you got to do something. So I think it's relying on your gut, and then relying on those data and knowing that the pandemic changed the way children learned, changed the way the interactions happened between providers and students. And then I think what we realized very quickly was that that children needed more than just learning. That children needed to have the interaction, the social interaction, to really crystallize learning. So my background, I'm a child psychologist, and I know that learning happens not only through like input, but actually through interaction and through play. And that's how children work out all the math problems and the science things that they have in their heads. So we very quickly said, let's create something to really address both the learning loss that kids were experiencing and the social isolation. And that's when we created those the learning hubs. What's going to happen after this is that our children are so resilient that they were not only able to make it through a pandemic, but they're able to thrive through it. So we've got children who now know and understand the rules of mask wearing, the importance of hand hygiene, and that when you're sick, you stay away from folks. So we've actually taught a whole cohort of children how to take care of themselves. We've also been able to teach a whole group of children that they are so important to us that we were willing to shut a whole city down for them, and that we were willing to stand up places that traditionally were not for children, like a museum, and turned it into a place for children. So hopefully the children of San Francisco know that this city was willing to do anything and everything to help them and take care of them. And as we move through this pandemic, I hope and I expect the rest of our city will continue to do that for our children.
Thank you. I'm going to come back to the question about what it's like to be a woman in your position. I want to quickly ask Dr. Naveena, Bobba, and Dr. Andrea Tenner, and I'm so sorry if I'm messing up names, I don't mean to. Something about the Delta variant, because that's what everybody wants to know about right now. We don't want people freaking out, we want the correct information. So as the Delta variant has shown, we are not out of the woods yet. What kind of practices do you think should be encouraged at this time?
Yeah, I'm happy to start, and then Dr. Tenner, please chime in. And I think, this is what we spend our days and nights thinking through, how, especially in our command structure, how we can protect the city the best in the best ways possible. We know that what we know about Delta is it's more transmissible. That means it spreads much more easily than the previous variants of the virus. That just means that, if somebody's sick, they're going to spread it much more quickly to all the other people around them, especially if people are unvaccinated compared to previous versions of the virus. And because of this, it's going to be a lot harder to stop the virus with, the normal things that we had been doing. But those are still good things to do. So we are really encouraging everybody to mask indoors, just because this disease spreads so easily. And ongoing, just considering your environment. We know outdoors, you have a lot better ventilation. So if you do want to gathering outdoors is much more better, especially if you don't know the status of the people that you're interacting with. And then thinking through just what risk activities you and your family want to take, because all of this is very personalized, but in general, it's the same public health guidance that we've been giving. And then the biggest one is to vaccinate. So if you're not vaccinated yet, that is the best way to stop the pandemic. What happens with vaccine is that it's harder to propagate the virus when someone's vaccinated. So, if we can stop those chains of transmission with vaccination, that really is the gold standard. And Dr. Tenner and all of the DPH task force has done incredible work on trying to get that vaccine message out. And they are making incredible strides, even in some of the populations that have been lagging. And I'll let her talk about that.
Yeah, thank you, Naveena, I appreciate it. I think I just can't stress enough, vaccinate, vaccinate, vaccinate. I think, my prior background before the pandemic was I worked in global health and humanitarian response. And so I have worked in places, I've seen measles, I've seen rabies, I've seen mumps, I've seen almost all of the vaccine preventable diseases. And just, I before the pandemic, I was a strong believer in vaccines. But in seeing, I can't express how amazing it has been to see the science world come together so quickly to actually modify the timeline, but not the process for developing a vaccine. So the vaccine process that we went through is this tried and tested process. And, I think as an emergency medicine physician as well, I was one of the first people in San Francisco vaccinated. And I read all of the literature about it. I went through all of the information. So I think it is a very safe vaccine. It's something that I think honestly, it's kind of a miracle of science that we have been able to get a vaccine this effective this quickly. It is a vaccine, and I think that's one of the things I would say is if you are on the fence about it, and I know that this is sort of there's a lot of information when you get into how the sausage is made. It gets very confusing with some of the information there, but we have people, we're trying to make providers available and people who know physicians, nurses, people who have the medical background to be able to answer those questions. So if you have questions about that, please reach out so that we can try to address those issues. And I would just say that, I think as Dr. Colfax commented, the vaccine's the difference between a sniffle and suffocation. We know that some people with the vaccine is not 100%. And so some people can get COVID, but it's very mild, as opposed to what we're seeing right now as hospitalizations with people who aren't getting vaccinated. And I think it's an easy way, it's, it's a poke, but you get through that and it's an easy way to protect you. And then I think the other thing is that, the existence of a vaccine doesn't protect you. Getting it in your arm does. So it's really important that you get that vaccine. I think the other thing though, is we have to protect each other as we've done. And that again is something that I think San Francisco, I've worked all over the world. I've been to all 7 continents, and I've never seen a place that comes together in the way that San Francisco did during this pandemic. And we take care of each other, and continuing to do that, continuing to mask, even if you're vaccinated indoors, as Dr. Bobba said, you know, when you are with this transmission, we've got to protect. If you don't know if other people are vaccinated, you want to protect them as well. So doing the things we know how to do, social distancing, masking, and getting the vaccine. And if we can help with any of those, that's what we're here for. So please, please reach out. Thanks.
Thank you. In this question, we're going to shift a little bit to talk a little bit about homelessness. So Abigail, during your time as director of the Department of Homelessness and Supportive Housing, what were some of the key practices and programs that were successful over the course of the past year and a half? And is there any of that you think the city should look forward to keeping or expanding?
Thanks for that question. So to answer it, I want to go back to March of 2020. And as the pandemic came to San Francisco, people were terrified that people experiencing homelessness were going to contract and pass away from COVID-19 in the thousands. And that they would also be conduits of the virus across the city. And we heard this daily, and the fear of people living unsheltered and unhoused who could not self-isolate and have that healthcare of housing was incredible. And the fear of our community was also palpable. People experiencing homelessness often have complex medical needs, and so many of them were at increased risk, not to mention living in close congregate environments. But that fear was not realized in San Francisco. In fact, along with our partners on this call and many other particularly women leaders who I had the honor of working with, we kept the COVID rate among the homeless population at the same or below the general population. And unfortunately, that was not the case in other communities like New York, Hawaii, Alaska, Boston. So there's much to be proud of. And we should hold that, and we should be grateful to the public servants, the frontline workers, and the nonprofits who continue to make that possible. In terms of what we should pull forward, I think we need to rid ourselves of the idea that there is one program, one silver bullet, one new program model that is going to end homelessness in our community. If that existed, innovative people in San Francisco would have already invented it. And in fact, they have. So yes, we had new models, expanded models, we had hotels, we had safe sleep, but those were really all building on best practices from before the pandemic. What I hope we bring forward are practices rather than programs. And those are three: scale, speed, and systems change. Scale, speed, and systems change. These are not things that make for good press releases or ribbon cuttings, but they are exactly the levers we need to pull to end homelessness in our community. Thanks to the investments of Mayor Breed and President Biden and the state of California, there is finally tremendous resources flowing to the homelessness issue. And if we can harness the political will, the community collaboration that Dr. Tenner spoke of in our community, and we can bring that sense of, what is my job? How can I as a citizen help with this? How can I help to take care of my community around homelessness forward? That will allow us to get scale, that will increase our speed, and the systems change will allow us to match the housing solution to the need of the individual. Again, not sexy, but it's absolutely the levers that we need to pull. And we're very lucky that there's an incredible team. I served with an all-female leadership team at HSH who are still there, who are joined by new leaders and new staff joining the Department of Homelessness. And they deserve our support. They deserve our questions and our curiosity and our belief that we can do this together.
Thank you so much for that. So another question for you actually is about vaccination within the homeless community. Were homeless people provided vaccinations, and even the ones that were like sadly sleeping on sidewalks and other situations with tent cities and things like that? Did you come up with any policies or support for people who were in that situation? Sorry, that was a long question.
That's a great question. So I'll get started, and then I'll probably toss it to the doctors on the call who can both update where things are now and fill in any gaps. So long before the vaccine was approved, we were in deep collaboration with the Department of Emergency Management, Mary Ellen, and with the Department of Public Health, establishing trainings, ambassadors, outreach. How were we going to, as quickly as we possibly could, deploy the vaccine when people experiencing homelessness became eligible? And so on the day that the state allowed it to go to congregate settings like shelters, it was rolling in San Francisco to navigation centers and shelters. And so that speed and that urgency and that preparedness really served us well. But it's not the moment of rolling up with the vaccine. It's all the work that leads up to it. It's the building trust. People experiencing homelessness have been failed by almost every system that our society has to offer. And so working with trusted individuals like the nonprofits who work with folks day in and day out to build their understanding to help them act as ambassadors was critical in the uptake and adoption of vaccine among people experiencing homelessness. So the short answer is yes, absolutely, they were offered it. It is going on the streets, it is in the shelters, it is in the housing, it is available to people experiencing homelessness who want to get that shot. I don't know, Drs. Tenna and Bobba, if I'm out of date in any way or if there's more to add, please chime in.
Thanks. No, that was a perfect summary. Thank you very much. I think that as you mentioned earlier, we were very concerned about this population and remain concerned because, as you know, they have often been failed by systems and the resources that are available to access, or it can be limited, it can be challenging. I think we are very fortunate in San Francisco to have a very robust support structure for persons experiencing homelessness. We have street medicine, we have shelter health, we have all of the HSA and HSH staff and resources. We also have community-based organizations and neighborhood community clinics that serve these populations. And it is challenging. If you don't have an address, it can be very hard to find you to get you vaccine.
Okay. I think we have a little, okay, we'll just give her a minute. Thank you so much, Andy. I'm so sorry that you're frozen.
Oh, okay, sorry. Okay, apologies for that. I don't know what happened, but it's the times. No, but what I was saying is that we have a lot of resources and we have a lot of people looking to try to provide our population that's experiencing homelessness with vaccine and resources to make the decision about vaccines if they're on the fence about it. So we are continuing that work today. Thanks.
Wonderful, thank you. So we are at like 10 minutes and I just really, feel so inspired and this was so informative. I'd love to shift this conversation a little more to about what it's like just for you all being women in this position and doing all the things that you've done for San Francisco. First of all, thank you. I really appreciate everything you're doing and I'm just really honored to be a part of this conversation. Can I ask you all, what is it like just being here in this space? And rarely do we get recognized as women making impact in all the things that you've been doing for San Francisco. Supervisor Stefani, I'd love to start with you.
Thank you, Meaghan. Yeah, I have so much I want to say to that, but I want to hear answers from everybody else. But I have to say that there was one time where I was on a call, like a virtual room with everyone, and we were all providing solutions and we were hearing about the solutions. And I found sometimes that people often took credit for the work that these incredible women were doing behind the scenes anyway, or accused them of not doing the work when they were doing the work. And that was a little frustrating to me. So I think sometimes it happens, but no doubt that plans were in process, things were getting done. And sometimes I think it's easy for people to take credit for other people's work, but I think that was frustrating that I saw that happen a few times. But I just want to say one more thing too, is about what it's like to be a woman through this. And I'm a mom. I have a 16-year-old son and a 12-year-old daughter. I also have a dad who's very sick, 2.5 hours away, suffering from Lewy body dementia. So I have those responsibilities as well to take care of him. And what I want to say that just kept coming up for me when we're talking about that is the mental health challenge that existed for so many. And this feeling, I feel like my kids and I got even closer because of the pandemic, and this feeling of it's okay not to be okay, and really driving that home. My son came to me the day after the election and told me that he wasn't okay. And we were, thank God, immediately able to get him what he needed, and he's doing fine now. One day, my daughter had to leave her Zoom class because she was just overwhelmed. They were talking about murder hornets, and it was like the last thing she could handle was like, okay, the pandemic. Now we're talking about murder hornets, and and I really had to focus on their mental well-being. But there were so many, the increase in suicides, the increased use of alcohol too, everyone kind of joked about that, but it's really serious. I mean, addiction is a very serious thing. And since we all just saw Simone Biles set an example of what it's like to take care of yourself, and that, physical injuries, people can see those, but, when you're suffering inside your head and maybe nobody else can see it, you need to be able to say, I'm not okay. It's okay not to be okay, and seek the help that you need. And I think that this pandemic for me really drove that home. And it's something that I will continue to, tell my kids, their friends, and, anybody I possibly can. So that's where I'm at with that.
I was trying to put a little heart emoji in the corner while you were talking, but it wouldn't let me. So here's a big heart for you. I'd love to pass it over to Andy.
Thanks. Yeah, I think in a lot of ways, the isolation that we experienced through this, in some ways, it sort of I feel like it brought me closer to people and some of the communities. Having Zoom calls with people that I might not, that live in other cities and that live in other places, I think was really helpful. And I think to what Supervisor Stefani was saying, it really, that it's okay to not be okay, and really acknowledging that, like, this is hard. And I felt the same way your daughter did about the murder hornets. I was like, really? Something else? So, I think recognizing that, and just, I think the other thing that I felt, or that was a part of this, ironically, was just, it was inspiration and hope. I mean, I think working with this panel, with all of the individuals on this panel, and then the people that we met, and I think how much people dug deep to really step up in this and to take care of each other. And even things like people I had just met a couple of friends on a trip prior to the pandemic. And when the grocery lines were out the door, and I was working 17 hours a day and I didn't know where I was going to get meals from, they shipped me a bunch of pizza without asking from Chicago, deep dish. And I ate that for almost a month, I think. But it's just people really reaching out and sort of recognizing, without asking for help, recognizing that people might need it, and really stepping up and taking care of each other. And I think that it was really inspiring. And so there were definitely dark days, but I think the silver lining was really how amazing, how much people stepped up, and the resilience that they had.
Thank you. Mary Ellen Carroll.
Thank you. I just want to comment a little bit on what the supervisor spoke about. So, I went from leading a relatively small Department of Emergency Management, to having a leadership position over this entire COVID command with thousands of people. And the way that I look at that responsibility as an employer, a manager, is, I feel responsible for the health and welfare of the people that work for me and the environment that they work in. And so that was something that, we would have these all staff meetings every Friday we'd have hundreds of people there. And I really tried to be very honest and talk about my own experience and how hard it was and the things that I was going through. I talked about how I have a therapist, you know, because we need people to understand like that's okay. I'm not ashamed of it. I'm glad that I have the privilege of having one. You know, and I had a lot of people come to me, mostly women, thanking me for being honest. And something that Maria, you said about kind of going with your gut and being, I really felt for the first time that I led with intuition, that I just went with what I knew was to be right, the right thing to do and the right thing to say. And that meant that I was myself, that I was not pretending to be anyone I wasn't. I spoke of my own experience, and I took the actions that I knew in kind of intuitively were the right thing to do. I'm also a mom. My kids are older, 20 and 22, and actually my daughter is in the room with me. She's gonna get really mad. She happened to visit me at City Hall today, so she's listening. You know, I want my kids to be proud of me. That's one thing, you know, but they're young adults, and so, you know, they have suffered enormously. And in some ways, I think we all have our, you know, it happens differently for little kids, teenagers, you know, like your supervisor, and then these young people that are starting their lives. And, you know, we talk about how this is like a pretty crazy way to get started. My son graduated from college during COVID, but, you know, having perspective that this, while this is a major event and will never be forgotten, and certainly won't form probably these humans as they move forward, that it's just the beginning of a life, right? And that we have a future. And I will say this week has been very difficult. I just want to, just as we're on the theme of being honest, this has been a hard week. And I know probably for Andy and, well, for all of us, right? Because it's, you know, it's hitting us hard. It's not over. It's really in our face. It's scary. So it's like, really like a one day at a time thing, and what's the next best thing to do is where I am right now. And, you know, I know if I'm feeling overwhelmed, and I feel like I have a lot of tools in my toolbox to deal with that. But anyway, so I just say that here now, and if anyone's listening, it's really damn hard right now. But, you know, we keep going forward, and we take the bites that we can, and we take it one day at a time. So thanks for the opportunity.
Thank you. And we do have like a couple minutes left. I want to make sure I get everybody to answer this question. So just stick with me for a couple of minutes. I know you all have busy things to do. You're running the city, but, you know, I really appreciate what you're saying here. Maria, take it away.
Thank you. I'll try to be short and succinct. Being a woman in position of power, leadership during COVID, I think everyone has talked about it. I'm going to go back to, it was wonderful to be surrounded by other strong women. You know, so when you're leading and moving in a pact, you feel comfortable. So when I hear my colleagues speaking strong, it gives me strength to also speak strong, to stand strong, to talk about my emotions, to break down in a meeting and still feel that it was okay. And I think that's the importance of women leadership and women coming together and supporting each other, because I felt that from our mayor and from my senior team, which are, you know, I have a fantastic team of women. And so bottom line, that was really helpful. And, you know, for the first time, like Mary Ellen said, following your gut was okay. Like, it was okay to come in and say, well, my gut tells me this. And everyone was like, oh, really? And they listened. And so that was very powerful. And that's something that I'm going to continue, you know, outside of this, because I'm going to be like, you listened to me last time. So yeah, you're going to listen to me again this time.
Amazing. Dr. Naveena?
Yeah, I'll just echo. And I think one of the things is when you get into leadership, roles, there's always this a bit of a facade that you have to have it all together and that you have to, you know, never break down, and that all the decisions are going to be calmly made, and that you're not vulnerable in any way. And I do think for me, actually, it was a deep personal growth because, you know, I started to realize in myself, I could see when things were not going well, right? And when I had to physically say, I need to step back here because, you know, these next days are not going to be good for me, and it won't be good for the team either. And seeing that, and I think all of us are echoing that, is that that is actually, it took a lot of strength, because again, as a leader, you're always expected to be there, to be on time, to like look happy, and to, you know, just say all these wonderful words to everybody and inspire, and we're just not always there. But the fact that, you know, this whole team has expressed some of the vulnerability that we all went through, I think is a huge step forward, and really actually strengthens us, not just only as a leadership group, but as a whole city family, as we try to come out of this pandemic and think about mental wellness and what that means for the workplace moving forward.
Thank you so much. Abigail?
Thank you. So Mayor Breed appointed me to be the interim director of the department 2 weeks before the pandemic hit. And at the time I had a kindergartner and a third grader. And so, you know, deer in headlights comes to mind. Under my desk, or at least that's where I wanted to be, was a real thing. And my family and my friends and my colleagues at HSH and in the whole sector of homelessness and on this call and across the city picked me up and believed in me. And even when that was the case, I found that people wanted to set my voice aside. Sometimes that was because I was a woman. Sometimes that was because I was an interim director. And sometimes it was because I was speaking on behalf of people who have less voice. And so it was very convenient to set my voice aside, whether intentionally or unintentionally. And so I then dug back to the mission, my own personal mission of working with the most vulnerable, watching my own kids find flexibility and resilience and bravery through the pandemic was incredibly inspiring. They used to give me hugs in the morning to charge me up, like, oh, mom's on empty, like give her a big hug and charge her up with her gasoline. Or then they started moving it to a more sustainable, it wasn't gasoline, it was plug-in, so that I could have energy to go off for the day. And I think what I ultimately came to realize is that's all we've got. We've got the love and the support in our lives, which we need to lean on and rely on. And then we've got our own tenacity and our own knowledge that we are acting in service of a greater good and another human. And so even when I was set aside, or I felt ashamed, or somebody embarrassed me, who cares? I still need to speak up. I need to speak more loudly or differently if I'm not being heard. And so that concept of growth and comfort never coexisting, that was the definition of the pandemic for me. So the growth was tremendous, and the comfort was never there, and the exhaustion was huge. But that's what we need to do if we want to grow as women, if we want to grow as a community. We have to be willing to kind of love each other up, charge each other up with, you know, battery and hugs, and exist in that split space of discomfort so that we can improve together.
Thank you so much. And Andy, you went, right? Okay. Well, that was amazing. I really appreciate you all opening up and being vulnerable in this space. The last question I had, which we won't have time for, unfortunately, was what advice do you have for women who want to be in your position? I mean, what I can say is my takeaway is you can go to school, you can do all the things that you need to do to get into your positions, but really it's about, you know, understanding that you're human and that you have feelings, emotions, that you can show up in a space and own it. But when you go home, you need a moment. And, you know, I really value the time that we spent together, and I really appreciate everything that you said. It's good to get to know you in this space. And I hope that, you know, people can take away something really, that powerful message after having watched this. And I hope that we could do this in person one day. It was really great. So I just want to thank you all so much for allowing me to talk to you. Supervisor Stefani, thank you. And I'll let you close it out.
Thank you so much, Meaghan. I'm so glad you were able to do this for us today. And just really quick, to all of you, I feel so lucky to know you. I'm so grateful for the work you have done for our city and continue to do. And I continue to look forward to working with you as we, face the hurdles that are still in front of us. So I feel so lucky, like I said, to know all of you, and that I get to work with you is just a gift. So thank you, everybody.